life, sex, goals, and oh, hell knows, this is Midlife Craving. Cravers, I am so excited. Dr. V, my OBGYN, is here, and I want to get right to it. But first, I've been taking my time getting to know my new Tracy's Dog toys, and I have found a new Rosie. I love Rosie. I always have. But every rose I have, it's died. For those of you counting, there's been 4. And listen, I know I use my toys a lot, okay? Like I'm working them out. But come on, that should last a lot longer. So I refuse to buy anymore, and I'm sad about it. But Tracy's Dog sent me this new toy called P-Cat. It's P.Cat. When I used it, I realized it is exactly like Rosie, except it's actually a little easier to hold. It's the exact same clip pulsing. I remember a pro tip is to use lube with it in the exact same settings. That 6th setting is the best orgasm. It's the bump, bump, bump. It edges you and it gives you that intense pyramid, or I also like to call it a stepladder orgasm. It's absolutely the most unique orgasm I've ever had from a toy. I've also been wearing her out for science. And she seems to be going real strong. Also, I believe in Tracy's Dog toys because I've been using them since 2017. Captain Morgan, I use him 5 to 6 times a week, and he's still going strong. So listen, if you're having the same experiences with your Rosie and she's dying on you and you have the frustration like I do, go get yourself a P-Cat at tracysdog.com. That's TRACYSDOG.com. Use code CRAVERS20 for 20% off. And she's only $39, okay? She's worth every penny. I would pay $39 per orgasm that toy gives me. When you get her, don't forget a little lube is key, and her 6th setting. That is where the magic happens. Again, that's P-Cat on tracysdog.com and use code CRAVERS20 for 20% off. And now welcome my favorite doctor to the show. I'm so excited that she's here. Dr. V, thank you so much for coming on the show. When I started the show in December 2020, and I cannot believe it, it's almost been 2 years, I always had 2 very specific guests in mind that I wanted to have on my show. A gynecologist, because I'm so passionate about sexual health, and then like losing the stigmas around STDs and stuff like that. And then also a divorce lawyer. So you are knocking out one of those guests for me today. And I cannot tell you how much it means for me for you to be here. So thank you so much for being here.
You're very welcome. Thanks for having me. And thanks for being one of my favorite patients.
Oh, thank you for that. I'm so excited that you're here. I'm so thankful for your time. I know how busy you are, how much you work, whether you're in the office doing pap smears, looking at vaginas, or in the OR performing operations like you had surgery with me, or being on call. Like people don't realize like the amount of time that you put into this. So I'm just so thankful. So I want to jump right into things with you. But first, I want to learn your story because I still don't know. Mm-hmm. And, how did you become an OBGYN? What did you wake up one day and say, I'm going to look at vaginas all day?
I think that's what a lot of people think we do.
Yeah.
So that's why I'm here. So that's a great question. And it's one that I don't know that I always know the answer to fully. I know I was definitely inspired by my first gynecologist mm-hmm. who delivered me, and my mom, mostly my mom's relationship with him that she had throughout her life. And she went through some stuff. And
it was a male gynecologist? It
was a male gynecologist.
Because you're my first female gynecologist. I've talked about it on my show before. I have all male doctors, mm-hmm. and you're the first female. So,
mm-hmm. And actually, that's something that's been interesting. Obviously, most doctors were male mm-hmm. At some point, and women have been kind of creeping in. And at this point, it's about 50-50 in medical school enrollment, and has been for a while. But certain fields certainly are still dominated by certain genders. And OBGYN is currently dominated by women. Whether that's a pro or a con, I don't know.
I think it's a pro because we own them, right?
Yeah, there's definitely, pros and cons. But, the fact that they had this lifelong relationship, and I just thought that was so cool. He helped her through all kinds of things throughout her life, and they had a relationship, and I just thought that was so cool.
So you went to school to be a doctor, a gynecologist specifically, like you knew that was your track.
I wouldn't say that. I wasn't pre-med, and my initial plan was not medical school. I actually graduated with a degree in biology and math, and I started at NIH doing, bench research.
Yeah.
So I worked in a lab for a while, doing medical research, and it was microbiology. Everyone worked so hard. They were there long hours. They put in so much brain power. They really were passionate about it. And I didn't really have the passion that they did. And it kind of occurred to me that, they work so hard, and they come in on the weekends, and they stay long hours. And if they're lucky, they might make a contribution that helps somebody
like
someday.
A breakthrough. Yeah.
Yeah. And everyone has to do that research, and it has to get done. And, there's a lot of little steps that lead to the bigger steps, and it's a process. So, not to minimize what they're doing, obviously that's necessary, but I felt like I needed to have a little bit more tangible impact on people's lives.
Yeah.
And so I think that's really what kind of pointed me toward medical school. I was like, I'd work really hard, which, long story short, you don't want to hear about that, but that was not my goal in life, but at least I would help people every single day.
Yeah.
And I would talk to people every single day. And
right. The face-to-face
I needed to be a little bit more social than some of the people in the lab I worked with. But I could, be with people and make a difference in somebody's life every single day, or at least more often than I would there. So that's kind of what changed my track. And then I ended up going to medical school, and I actually wanted to do anything but OBGYN. Because, the lifestyle is hard. The OBGYN lifestyle is very hard.
Right. You're on call. They're having babies all the time.
Yep.
Right.
Yep.
There's no schedule for having a baby.
And so I was kind of desperately hoping to fall in love with something else, and never quite happened. So that was kind of my destiny. Somehow.
Like, I feel so ignorant, but what does it take to become an OBGYN? So it's like 4 years of medical school, or no, it's 4 years of undergrad.
After college, which you have to take certain classes to get into medical school.
Okay.
So some people might do that as a pre-med track, or some people might just add them on to their other classes, or even go back and do, some classes over the summer. And then after you graduate college, you go to medical school, and that's 4 years.
4 years. Okay.
And then you graduate with your degree. Your MD, but then you still have to go to, and so you could at that point go out and do something that's not clinical practice. So for example, some people might go, work for the FDA, or you might go back to NIH and work, in a lab or something like that. But I'd say most people that go to medical school probably are planning on clinical practice. Because you got to pay off that medical school somehow.
Right. And then, so you go into clinicals, right? And then you go into your field and start.
So then after
hours?
Medical school, you apply to residency. So if you're going to do some kind of clinical practice, see patients, do patient care, you would go to residency. And that varies depending on the field. So something like, OBGYN is in most places 4 years.
Okay. Wow. This is a lot of dedication, by the way.
Yep.
So I spent my 20s in college. I got an MBA, but nothing like this. That's a lifetime choice.
It is. So by the time you finish with residency, you're now in your
20th year of school, right?
Yeah. So one of my favorite jokes whenever people kind of say, "Oh, you look like you're too young to do this," and I never know if that's a compliment or an insult, and I just kind of try to laugh it off, and I say, "Well, I'm old enough to go to school for 25 years, so it's old enough to take care of you."
Yeah,
so.
Really. That's a hell of a dedication.
Yeah. So by the time you're out of residency, you've already been doing it for 4 years.
Yeah.
So medicine is really an apprenticeship. And that's what it is. It's just like learning to take care of cars or learning to do woodworking. You start off working with people that know what they're doing a little bit more than you, and you just do it. And you get better and better, and people are guiding you along the way. And by the time you finish, you have some kind of pretty good skill. And then
Yeah.
the longer you do it, you kind of refine that and you're always learning new things. And so it's really an apprenticeship. It's a very old, very classic profession in that way. So that's kind of cool.
So let me ask you a question, because I feel really, I told you how ignorant I feel. I didn't know there was a difference between OB, and I just call you an OB/GYN, OB/GYN, or a gynecologist, gyno, whatever. I didn't know there was a difference. So the OB is babies.
So that's obstetrics. Yep. So
Okay.
An obstetrician gynecologist is what it stands for.
Okay.
And so you would start off going to a general OB/GYN residency program. You would get trained in obstetrics and gynecology.
So you're learning how to deliver babies and do pap smears and general women's health. Oh.
So it involves primary care. It involves, screening. It involves managing gynecologic issues. So period issues, fibroids,
there's so much.
Pelvic inflammatory disease, cysts, And then after that, you may decide to practice as a general OB/GYN and do kind of a little bit of everything, which is what I do. So, I'm not the expert in everything, but I know a little bit about everything and can handle a lot of the basic stuff.
But you also do surgery, because when you said, like, Adrian, I'm going to do your surgery, I was thinking, what? Isn't someone else going to do that? Like, and I feel so bad, but I was like, I thought you just did like office visits and you did, I knew that you would do, sonograms and pap smears and place IUDs. I didn't know you were actually going to be the surgeon too. So that's a lot.
Yeah. So a lot of people don't realize when they go to their gynecologist, if they are an OB/GYN MD.
Yeah. They're doing it all.
We do the bread and butter OB/GYN. We do C-sections. We do hysterectomies. We do hysteroscopies. We manage complications. But then we refer to specialists when we need to. So you can go on to get subspecialty training in something like gynecology oncology. So then there are people that go on to do 4 more years of fellowship training where, you'd be a specialist in gynecology cancer.
Yeah. Which is a big thing, by the way.
Or a specialist in urogynecology. So things like incontinence and prolapse.
There's so many things. And I'm going to be serious. Part of me is like, I don't want to hear about all the things because I'm going to get all the things. I feel like I'm always just like very prone to getting everything. So I'm like, I don't want to talk about prolapse. I don't want to talk about, whatever else can happen down there. Because I swear to God, I feel like I'm always the one that's going to get it.
Well, there's always treatments to talk about. So
there's just so many different things. And I think about something that's kind of cool about your job too, is that you're doing something different every day.
That's what I love about it.
Yes. Like you could be placing an IUD in the afternoon for me and then seeing someone that's pregnant and then doing a LEEP procedure the next day. Like there is a lot. Yeah.
Yep. I don't want to sit in the office every single day and talk to patients all day long. I want to do that one day. I want to go
pushing paper.
Yep.
Yes.
Yep. I want to be in the office one day. I want to be in the OR another day. I want to be delivering babies on L&D, running around. So,
God, that is a very wide variety of things that you're exposed to every week.
It is. And
I think we're going to talk more about HPV and the LEEP procedure and all this stuff, but I'm just like, it's so weird that you cauterized my cervix. You took it's just so crazy. You know what I mean? I think about that. It's just, it's wild.
Yeah. You can't think about it.
You're like, I was there. I know. All right. So let's kick things off. It's awesome to hear your story because I didn't know, but let's kick things off with, I'm dying to know, a few things that you would do as an OB/GYN and a few things that you would never do. I have a feeling I know one of them, never douche, but we'll go there. But so what are some things that you would do or that you do as an OB/GYN?
So, these are things definitely took a lot of thinking, and I actually reached out to some of my friends from residency because we've got a good group of girls that I went to residency with that we still talk, and there were definitely some themes. So trying to kind of condense it down, I think the most important thing is communicate with your gynecologist. Like I said, we're there to be your advocate. We're there to help. Yeah. We would not do all of these things. We would not stay up all night. We would not go through all this training. We would not work late nights just because we didn't care. So we're there to help. Be honest with us. Tell us about things that you're concerned about. Tell us about problems you're having.
Mm-hmm.
You know, maybe it's a red flag that we need to know about. Maybe it's not normal.
Mm-hmm.
Maybe it means we need to rule something else out. Maybe there's a treatment and you don't have to suffer with this.
Yeah.
Now maybe that treatment's not what you want to do and you're not interested, and then that's fine. But at least you know it's a thing that's out there.
Mm-hmm. That's a really good tip, communication.
Yep.
And that's one of the reasons why I love you so much as my doctor, because I'm so comfortable talking with you. And we'll talk in this episode about issues that I've had, because I feel like sharing, I know there's women out there that have probably experienced the same thing, but that they're scared to talk about. And I'm not. I'm here to say, you know, speak about it with your doctor. And even when I told you, like, I'm in the lifestyle and it's something to talk about because I have multiple sexual partners, and putting it all out there is key for sure.
Yep. And we care, you know, and we want to keep you safe. That's our job.
Yeah.
And I guarantee you, we've heard it before. So
right.
We're not there to judge you. We're,
right.
you know, we're there to keep you safe. So let's see. So things like painful sex, heavy periods, you know, incontinence, those are things we can, you know, we want to know about that stuff.
Yeah.
And then along those same lines, you know, let us know if you're scared of the exam, if you have painful exams, if you've had bad experiences, if you have a history of trauma, tell us. You know, we're not there to torture you.
Yeah.
We want to know, you know, I always appreciate when a patient tells me, hey, I have a history of trauma, you know, okay, great. Tell me, how can I make this easier for you? You know, and we hope to be sensitive with everybody, and we hope to be gentle and kind with everybody, but it really does help us when somebody gives us that heads up, and then we can take that little extra time or that little extra care, sensitivity.
I didn't even think about that.
Yeah. So I've had a lot of patients that do give me that.
Let me ask you a question. When the fuck are they going to put us under or give us something, some codeine, Tylenol, I don't know, for the IUD placement? Oh my God, that is so barbaric. I'm sorry. It is. It just is. Like, can we like push that up to the, like, can we talk to the person that's in charge and be like, can we please help? Like, getting an IUD placed is no joke. That's why I asked you when I got put under. I was like, can you please just give me a new IUD? Because I don't want to do that when I'm awake. It hurts.
Yeah. So there are a couple things we can try for that. So first of all, if that cervix has been dilated recently, like if you've had a baby recently, it tends to be a lot easier. So a lot of women, I've actually had patients tell me, oh, you put it in.
It's funny you say that, because after I had my daughter, I got an Dr. Rebka placed an IUD, and I went to the gym after. The second one I had, I sweat through my shirt and was like, felt like I was in labor. And yes, so that's a big thing.
So it's actually something we've studied as a you know, not a practice, but a specialty, you know, what can we do for pain? And there's a couple different things we can try. One is called a Cytotec, which is a prostaglandin similar to, you know, helping you start your labor, that softens the cervix. There's actually been a lot of studies on whether that helps or not, and the data is kind of mixed. But the way I'd say me and a lot of my colleagues feel about it is, you know, if it doesn't hurt, why not try it? Because it probably does help for some women. And I think it does. So it's a medication you'd put it in your vagina like the night before or the morning of, something like that.
This is good to know.
It can cause some cramping, sometimes some bleeding, so not everyone loves that. But then I think it does make the cervix a little softer, a little easier to go in. So that's one thing I usually offer my patients unless they've had a recent baby. The other thing that sometimes we do is something called a paracervical block, which has also been studied. And again, the evidence is kind of mixed whether it helps or not. But we basically inject numbing medicine, so like lidocaine, around your cervix before we place it.
Oof.
So I don't tend to do that because, you know, again,
at that point, I would just rather get it done.
Yeah, exactly. So we think that may be just as painful as putting it in. So again, if it's not shown to really help and it could cause harm, so additional pain, then I'm not going to do that. So, but that's always an option, you know, that some people swear helps. So some docs out there do it. The other thing we sometimes offer patients is, you know, take something before you come.
I'm not gonna lie, Dr. V. I told Katina before, I was like, girl, I'm taking a half Percocet. I took a half Percocet before I came in. My last time I got one in. I luckily was able to have the new one put in during my surgery, which, by the way, I've had no period.
That's great.
Like spotting like once a month. Oh, God bless the IUD. But oh no, I was doing that. So anyway, all right, sorry to sidetrack you. Back to things you would do as an OBGYN. Because I think it's important.
Oh yeah, so along those lines with communication, I think the last point I had here on my notes, if things aren't going right, come back, follow up.
Yeah.
You know, if you're concerned about something and we start you down a treatment road, if we don't hear from you, we assume it's going okay.
Yeah.
You know, we're not trying to blow you off. You know, we're assuming that it's going okay. And if it's not, then come back.
Mhm.
You know, and we can't always fix everything in one visit. Sometimes we have to try a few things. So,
Yeah.
and that's why we're there. We're there to create that relationship. We're there to work with you. Not everything works for everybody. So
I'm always preaching in the lifestyle and in general, use your motherfucking words, right?
And then let's see, next thing, make health a priority. So I can't tell you how many patients I see. You know, they're busy. Everyone's busy, and people are busier now than they ever have been. I would, you know, and as somebody who's busy myself, I get it.
Yeah.
But knowing everything I know, you know, health is so important, and you just can't push it. Now is the time to exercise, make it a priority, take care of your mental health, see a counselor. Everyone needs a counselor.
Yes.
Everyone needs to exercise. Everyone needs to be active. Eat healthy. Get your screening tests. You know, your pap smears, your mammograms, and we'll talk about that, I think, more. And then follow up on the abnormal results. You know, especially if you had an abnormal result, don't give it 2 or 3 years before you come back because you were busy. Because I see that all the time. And your health is not your priority until something goes wrong, and then you have nothing. You know,
it's better to be proactive than reactive.
Absolutely. And it's easier for us to keep you healthy than to fix a problem. So I can't tell you, you know, seeing so many patients who do have issues with their health, you know, how I can't tell you enough how much of a blessing health is. And if you don't have it, then you really can't do anything else. So it's going to take a priority if you don't give it a priority.
Especially with getting, and I think we'll talk a lot about pap smears because they are so important. Getting your pap smear, I mean, that is literally what prevents cancer, right? Cervical cancer. Like what, 99% of it is that pap smear. Yeah, it's huge.
And then in terms of, you know, be honest, be safe. So safe sex. Be really open and honest with your partners. I see a lot of patients that, for whatever reason, want to keep stuff from their partners. And again, that's not my business. That's not my place. I do encourage them to have a conversation. But if there's somebody that you trust enough to have sex with them, then hopefully there's somebody that you can be open and honest with and safe with.
That is so huge.
Yeah. So be honest with them.
Yes.
Use condoms. And technically we're supposed to be using dental dams too. You know, which everyone's like, what is that? I heard about that in high school, like in my sex ed class. Does anyone actually do that? So
I don't use dental dams.
No, I'd say I can't say I've ever had a patient that told me they did. So
where would you even get a dental dam?
Good question.
For real?
You can get them online.
Okay,
or
online.
You can make them out of a condom.
Wait, so cut a condom in half?
You cut the tip and the roll off the end of the condom, and then you cut it down the middle. And then it's just a barrier. That's all it is. So
I can't say I'm doing that. I cannot.
A lot of people are not. Okay. You're not alone. So
it's funny. Let's talk about that because condoms are such a big thing, and you know, safe sex and in the lifestyle especially. But I actually spoke with one of my friends, and I said, you know, we're sucking dick, right? And then we're kissing, and then they're eating us out, and then we're kissing. Especially when I got HPV and stuff, I was like, all of that. It's happening. It's all going on. Like if you go down on me and then we make out and then I suck your dick, it's transferable, right?
Yep.
And it's something you don't think about. I think oral sex is definitely neglected when it comes to safe sex. And I have been in the position where, especially if someone's like, there's pre-cum, right? And like that carries all of the STDs. And so it's a lot to think about.
Yeah, and we can talk about STDs a little more too, but you know, some STDs are or we call them STIs now.
Okay.
They're sexually transmitted infections.
Infections, right.
Because the disease part kind of sounds like a stigma. But,
it does.
At least in the professional world, that's what we're trying to call them these days. But yeah, some are transmitted more by secretions. So things like semen and vaginal secretions, saliva. Some are transmitted more by just skin.
HPV,
so like
skin to skin.
Yep. So HPV, herpes, those are more skin, mucosa transmission. So they're both a little bit different. And condoms work better for some than for others.
Yeah.
So condoms tend to work better for the disease, the infections. Sorry. See, everyone calls them that. The infections that are spread by more the secretions.
I'm sitting here thinking, I'm like, oh God, it's a lot. You know what though? I have conversations with my partners. How often do you get tested? When was the last time you get tested? Show me your tests. So, you know.
Yep. And I think a combination of all those things is how you protect yourself, right? So condoms as much as you can, or barriers, and then limiting your partners. So even if it's not, well, but you but you don't realize that you are. So,
no, I am.
You know, if if you have a new partner, you're screening, and the partners, even if there's a pool of partners, you know, they're all getting regularly screened.
Right.
Hopefully they're keeping it relatively within the pool. Yeah. You know, so even if it's a pool, it's at least better than, you know, random people.
Right. The lifestyle is, I mean, it is, safe sex is what it's all about. So for sure. Testing,
while it's not as safe as being with one monogamous partner, it's still safer than, you know, you're making it as safe as possible by keeping it in a pool. If that makes sense.
No, it does. Definitely.
And then regular STI screening, getting your HPV vaccine, washing sex toys, or using condoms with them if you're going to share them, especially. And then, so that was what, number 2?
Yeah. What other things would you definitely do as
so number 3 is easy. Take contraception seriously.
Oh, yes.
Especially in this climate. I can't tell you how many patients I see who think they can't get pregnant and then oops. Or
we know they call people that say they just pull out parents.
Yeah. It's surprising how many people rely on that, and that's fine as long as it's okay if it doesn't work. You know, so it's all about how much you want to avoid pregnancy. So if it's okay to get pregnant, then fine. But you know, if you can't get pregnant, then please use really good contraception and take it seriously, and don't believe anyone who tells you that you can't get pregnant. I can't tell you how many patients who tell me, oh, well, somebody said I had endometriosis, so I can't get pregnant. And now, oops, here I am. Or somebody said I had PCOS and I can't get pregnant. And oops, here I am. So, if you have a uterus and ovaries and tubes that go between them, then probably there is some way that you could get pregnant.
The odds are in your, Yes.
So take that seriously.
Yes, that's a good one.
And then pay attention to your periods, you know, your menstrual cycles. That a lot of people don't realize that there is a beautiful symphony of hormones in your body. Your brain, your ovaries, your pituitary gland, it's all communicating in this beautiful symphony. And that ultimately every month causes a period. And if that's not going right, then there may be something going on.
And talk to your doctor about it.
Talk to your doctor. So, you know, if your periods are spacing out, if they're too frequent, if there's abnormal bleeding, super heavy, you know, you're skipping periods, there's something going on. You know, it's a vital sign. We call it the extra vital sign. You know, just like your heart rate, your temperature, your blood pressure, your periods ultimately telling you
something's going on.
You know, what's going on with your body.
So fun fact, I did not know what your body really goes through until I decided to try to get pregnant. So I bought this book. It's called Taking Charge of Your Fertility. You ever heard about it?
Not that one in particular.
It's by Tony Weschler. I swear to God, if you touch that book, you're going to get pregnant. Okay. So like, this is a thing you might want to share with your patients, but I did what's called charting. So you take your basal temperature in the morning.
Love it.
And then the biggest thing is that cervical fluid. I had no idea. And I know several women right now are going to be shocked by this, but here's what it was for me. Sometimes you would go to the bathroom and you wipe and you're like, am I like what's going on? It's so wet and mucousy, like what is going on? And that's you're ovulating, right? Like your cervical fluid has that like stretch. And I had no idea about that. And then further, I didn't know that your cervix actually regresses, like it goes up and it opens up in order to have a baby. And so sometimes sex can be painful during that. I had no idea about that. So it is true. Every 28 to 30 days, you're going through that hormonal cycle. You know, it's called a cycle, I guess, for a reason. Yeah. I had no clue about that. None. But now I do. And I will tell you if something's wrong. You know, I'm going to tell you.
Yes.
That's a really good tip though. If something's off with that, that's a vital sign.
And it might be something as, you know, simple as, you know, sometimes we see as women get overweight, their periods start doing funny stuff. And that's a sign that it's affecting your hormones and that it's affecting your body. Or you're under too much stress. You know? You're not exercising enough. You're not taking care of yourself.
Yeah.
And now that would be after you rule out all the other stuff, that would be dangerous. But
that's a good one.
It's
though.
a sign.
Pay attention to that.
And then the last do I have is be nice to your pelvic floor.
What does that mean?
So your pelvic floor.
Oh God.
So your pelvic floor is the collection of muscles that is kind of, your perineum, where, the bottom basically between your legs. And so people talk about things like prolapse.
Yeah. What does that mean?
Incontinence. So as we get older and under more stress and, physical stress, usually the just like we get sagging skin everywhere, we get wrinkles, we get bags under our eyes, all that, the vaginal tissue and the pelvic floor can get weak as well. And so a lot of that is genetic. So there is a lot that's not in our control. So I don't mean to scare people, but
yeah, I'm like, oh my God, is my vagina gonna fall out?
But so a lot of it's genetic, but there are things that we do have control over in terms of trying not to make things worse.
Yeah.
So things like straining with constipation all the time. That's not good for you. That just adds more and more pressure to that pelvic floor and helps try to make prolapse worse over time. Smoking is probably one of the worst things that you can do for your health in general, and people have no idea all the bad things it does. Maybe I should add that to my don't list.
Yeah.
But, don't smoke. Makes that stuff worse. Things like that. I'd say the chronic constipation is the biggest thing that you can
like pushing.
avoid. All the pushing.
Oh my God.
Yeah. So
Okay.
keep it soft and moving.
I don't do that, but I know people who do, and I know she's listening right now, and it's this funny story because I'm always like, it's an inside joke. Katina, you know what I'm talking about. But oh my God, yeah, pushing like that's bad. Let me ask you a question. So since I've had a baby, when I'm doing, Katina and I joke about it, when I'm doing jumping jacks or like you're in the thing, you're like doing like the like ab lifts, I'm peeing.
Yep.
Like, what is that?
That is stress urinary incontinence. And that is...
Or I'll laugh or sneeze and I'll pee.
Very common.
Ugh.
Very common.
Is that a sign of a prolapse?
No. So it's not a sign of a prolapse, but it is a sign that pelvic floor has been affected. Usually can happen... it's more common as we get older. It's more common after we have babies and pregnancies. And by the way, it doesn't matter if you have a vaginal or a C-section.
Oh, that's good to know.
Because pregnancy itself can cause that. But a lot of it's genetic and actually pelvic floor, training those pelvic floor muscles can help quite a bit with that.
So I've been doing Pilates, like pelvic floor and deep core exercises. Does that really help? It really does. Okay. Good to know.
And Kegels.
That's one of my questions. Kegels really work?
They do.
Okay.
So Kegels will really help strengthen those muscles. They won't help with the tissue laxity. That's mostly genetic and age related, but it can help strengthen the muscles, which helps keep from making it worse and helps correct the symptoms.
By the way, fun fact, I like to play a little game sometimes when I'm having sex. I'll be like, pull out and I'll squeeze as hard as I can. And he's like, oh, I like that. And I'm like, yeah, you do. And then I'll like, let it go. That's like a form of like Kegel exercises during sex.
Sure is.
Yeah. Okay. Yeah. I'm getting them in then.
You are. And there is actually such a thing as pelvic floor physical therapy.
Oh, okay.
So if doing Kegels on your own is not enough, or you don't know how, some people, their muscles are actually weak enough that they can't even do them. So you need a specialist to help with that.
But be kind to your pelvic floor.
Yes.
Okay.
So don't push.
All right. Don't push.
I mean, push to have a baby, but that's like, you're not doing that all day.
Get that squatty potty thing. That might help. Yeah.
So don't push. And, when you go to pee too, we're all in a hurry. But just sit there and relax and let it come.
I'm guilty of that.
Everyone is.
Oh my God. I joke around and I say that when women pee, it sounds like they're frying chicken. I'm sorry if I disturb your peace in the bathroom, but I swear to God, when you're peeing, it sounds like you're frying chicken. All right. That's good to know. I'm going to start thinking about that now. All right. So what are some things that you would never do as a gynecologist?
So douching, that's definitely one that is at the top of my list. And again, was a theme with all of my colleagues. So
it just throws everything off.
Yeah. So the vagina is a complex place with a collection of normal bacteria that do normal things. And the more you kind of try to clean out that normal bacteria, the more you throw things off.
Oh, okay.
So douching is not a good idea. We know that it increases the risk of bacterial vaginosis, which I know we'll talk about.
I know, and I hate BV. I have a very bad relationship with BV. Go ahead.
And then on that same vein, minimize irritants to your vagina and your vulva.
So do you use soap down there?
Some women can and have no issues. You shouldn't ever use anything inside the vagina.
Yeah.
For cleaning. I usually tell patients, especially most of them are coming with, issues with irritation and stuff, but not even hot water, just warm water in your fingers. No friction, no washcloth, no loofah, no scented soaps, nothing special down there. Just
you don't even
minimize.
Need it. Yeah.
It's a self-cleaning oven. So
okay.
Yeah. So and it's the most sensitive place in your body, so it's going to get easily irritated. So and then my second don't would be contaminating your vagina. So
what do you mean by that?
And your urethra. So the urethra is where your pee comes out, and that goes directly to the bladder, which should be a sterile area, meaning no bacteria. Remember, the vagina has all this healthy bacteria. And then right next door is your rectum and your anus, which has your poop. And that's where there's normal healthy bacteria there too. But those are different bacteria.
Right.
So what you want to avoid is the bacteria from your rectum and your anus coming into contact with your vagina and urethra.
Oh dear.
So that's why we always tell women, wipe from front to back.
For
when you
sure.
wipe your pee, so front to back. Try not to get the poop in the vagina area. But same thing when you're using sex toys or having sex. So
I was going to say, what if a guy fingers your butt and then fingers your vagina? That's bad.
I would not appreciate that as an OBGYN. No.
Okay. What about we're getting, listen, I'm eating ass, eating pussy. You can't do it. You need to take a break.
I'm sure people do it, and I'm sure they do okay. Yeah. But if I were an OBGYN, I would not feel cool about that. Oh, I would be like, don't do that.
Okay.
You're going to either change your condom or, use some kind of barrier and change it, or just go the other direction. So vagina to anal. Anus, yeah. Sure.
Okay. This is good to know. Yeah. Okay. I'm sitting here thinking of all these instances. Again, I'm dabbling in the anal world. Yeah, so
again, many women probably do it and do fine.
Yeah.
But those are my thoughts
okay. Yeah. All right. I like it. Okay. Good tips.
And then this should be obvious, but talking to my friends and colleagues, kind of getting inspiration for this. Don't put anything in your vagina that's going to hurt you. Yeah. So sharp things that can break and become sharp.
Ooh.
I've seen some stuff like that. My colleagues have seen that, people end up in the ER with tears and cuts and, and it never, and then it always seems like, duh, I shouldn't have done that. But
so I guess people do it. I have something to share. So Pawn Star, who was my fuck buddy for 10 years through college or whatever, his kink was inserting different objects inside of me. So cucumbers or hairspray bottles and I just think to myself, this is not really natural. Probably shouldn't have done that.
Well, some of those things are probably more likely to cause injury than others.
Yeah.
So I wouldn't be as concerned about cucumbers or, even hairspray bottles maybe, but anything with sharp edges or glass, maybe not.
I have had a beer bottle inside because that was his thing. Yeah. Okay. Good.
And that sounds like
it can happen.
Playing with fire there.
Yeah. So, okay. All right.
It's a very
bad girl.
It's a very vascular area, meaning there's a lot of blood flow. So when you get cut down there, it bleeds quite a lot.
Oof. Okay. Yeah. Luckily that never happened, but okay.
Well, good.
Good to know. Oh my God. I just want to say there are kinks out there that involve that. So
and as long if you do great, then that's great. But we've seen it.
Yes.
So it happens. And then don't worry how your vagina or your vulva looks. I think so many women are self-conscious. Yeah. And actually a lot of young girls are self-conscious and it breaks my heart so much. But
let's be honest though. When I come to you, I'll be at work. If my appointment's at 2, I will come home. I will spray bidet out all of it and then be all right, I'm good. And I'll make sure, I don't like to be clean shaven, but I'm let me have 2-3 days. I used to wax. I don't do that anymore. I just don't have time for it. And so I'm let me just make sure I'm I don't know. I am conscious about that though. I think everyone is, but you don't care.
No.
Okay.
Again, we're
full bush. You just don't care.
No. No. I will say, when there's a lot of hair, it might make it harder for us to really see the skin. Mm-hmm. In which case, it might be easier to miss some kind of issue there. But other than that, we don't care.
Okay.
Yeah, we do all kinds of stuff. We are interested in much more than that area. We've seen everyone's vagina and vulva looks different.
Yeah,
we've seen it all, and
there's
anatomy.
There is so many different types of vaginas. There is. Yep. I mean, I've watched a lot of porn, so I've seen a lot. And even being in the rooms with my lifestyle friends and stuff, like everyone looks different for sure. Mm-hmm. But I think a lot of women are self-conscious about like, they have vaginal rejuvenation and they'll have like long labias or whatever. I'm always like, oh, thank God I didn't. Cause like I used to work for a plastic surgeon who used to do that. And I'm like, thank God I don't have to deal with that. Yeah. But I mean, it doesn't matter. If it's not painful, it doesn't bother you.
Right.
It doesn't matter.
Some women, it does bother them for, like physically,
like hanging
for
out.
some reason, like it's irritated or something. But I'd say in general, most of the time it's just, people are self-conscious about it. And that, like I said, that breaks my heart.
Yeah, it doesn't matter.
Everyone looks so different and they all are functional pieces of anatomy.
Yeah.
And actually there's erectile tissue in a lot of the labia that people don't really realize, and you're now cutting that area and,
oh, right. Yeah.
If you're doing plastic surgery and putting yourself at risk of injuries and poor healing, which I've seen that too.
Oh man.
And pain with sex and like, why? It just, makes me sad, especially young girls.
Yeah. It does make you feel good that you don't care because I'm always so self-conscious. I'm always like, oh my God, I got to go down. I got to,
Nope, we don't care.
You're like, I've seen it all.
We have.
Oh my God. I have a question about some of the things you've seen. We'll get to that later. All right. So do you have any more don'ts that you would just never do?
The only other one I had was about, again, smoking. Don't do that. Mm-hmm. So I know that's so hard and most people probably don't want to smoke, but don't start if you haven't started because so many bad things about smoking. And again, I think as kids, we were kind of sold this smoking lung cancer association, but it's so much more than that. So knowing everything I know, I would never do that. And I've never let my kids do that.
Yeah.
And then as you get older, a lot of women do stop having sex for various reasons. So my last don't would be don't stop having sex,
Ooh. I love that. I love that. Yeah, I love that. Yeah. Don't
come find us and we will help you and we will work with you. And, once you stop it, as you get older and past menopause and further past menopause, it can be harder to kind of start again. So, we know that actually regular sex after menopause can help keep the tissue healthier and more open to sex. And so, yeah.
That's great to know. So use it or lose it.
Exactly.
Yeah.
So
I'm all about using it. So I will have no problems with that. That's a great have sex. Mm-hmm. Yeah. Also, I just feel like having sex just makes everything better. It just does. It creates the connection with you and your partner. It's a natural stress reliever. I feel like the world would be a much happier place. That's why I'm out here promoting it. Mm-hmm. Use sex toys, masturbate, have orgasms. Yep. It makes everything better.
And actually, as women get older, as couples get older, there's lots of different ways to be sexual without penetration. So there's a lot of issues, both male and female, as we get older that can make that harder. But a lot of my patients do continue to have great sex lives even without that.
Yeah, it's incredibly true. All right. So thank you for sharing all those do's and don'ts. They are amazing. But let's talk about HPV really quick because I just went through that with you. And I felt like it was a lot for me, to get the LEAP procedure and to recover from that and all that stuff. But what I really want to talk about is how prevalent HPV is. It's out there. What would you say, like at least, I'm sure several times a week women get back abnormal paps.
Oh, yes.
Yeah.
So abnormal paps are really common. And actually, our current guidelines say not even to do paps before 21. Because in younger women, especially, we see it very commonly. And we actually, so we don't even start PAPs until 21. We don't even start HPV testing until 30.
What?
Because before 30, we just assume that everyone gets it. So if you're sexually active, we kind of assume you're going to get it. We don't even care unless it causes a abnormal PAP or sticks around until you're older. So when we're young, our immune systems are strong and we're getting rid of it faster. Plus, it hasn't been able to stick around as long because we just haven't been around as long.
Yeah.
But as we get older, our immune systems are not clearing it as well. And it's more likely that's been around a little longer. And then that's when we start kind of wondering if it's there.
Well, also women in their 20s are getting the HPV vaccine.
Right.
Which is, that's a new thing, by the way. My generation missed that. And one of the biggest things that I loved and learned from you was you were like, Adrienne, get the HPV vaccine. And I remember I looked at you and I was like, but I have HPV. And you're like, yeah, one strain. There's, I think, 114 strains out there. I think 16 or 18 are like cancer causing types. I forget the number, and that vaccine prevents it and men can get it too.
Yep.
Yeah. So someone had said to me, Dr. V, they said, my doctor said, I don't need it. What would you say to, I said, go somewhere else. Like, if you're sexually active, you have multiple partners, I feel like you should get it.
Yeah. So our official guidance from the CDC is basically that it's recommended up to 26 years old. And after that, it's approved up to age 45 or 46. I'd have to double check. And of course I forgot, I'm sorry. Up to that, it says talk to your doctor. And the whole reason for that is from a public health standpoint, it may or may not be cost effective. So if we were giving it to every, 40-year-old, it's probably not as cost effective as if we were giving it to every 20-year-old. From a public health standpoint, health prevention.
Right. Not everyone needs it.
Right. But again, that's why they say talk to your doctor.
Yeah.
So, someone who's having multiple sexual partners, or you're in a new relationship, or you are in the dating pool again, those are great times to get the HPV vaccine if you haven't already.
Yeah.
I've had plenty of patients who, they say, oh, I don't need it. I'm, in a long-term, marriage. I've been married 30 years, whatever. But now I've had patients that are, 50s or 60s. Now they're either widowed or divorced, and now they have a new partner.
Or let's be honest, partners cheat.
Correct. I've seen that too. Partners cheat.
Yeah.
And now they have, now somebody has a new strain of HPV. Now you have an abnormal pap. Now you need a leap. And wouldn't it have been nice if we could avoid all of that?
Yes. Agreed. So when you have women who, I'm so curious because I had this procedure, are most of the women that you give LEEP procedures to in their 30s and 40s? Like, is that the age group that they're in, those who need it?
I do LEEPs on women of all ages, actually. So I've had girls in their 20s and 30s that just had high grade paps that stuck around. I've had women in their 60s and 70s. And everywhere in between. I
have a question because I'm curious because I just had a LEEP. I will see you again in a few months and we'll do another PAP. If that comes back abnormal, what do we do now? What do we do next?
It depends on how abnormal. So
if it's L-sil or H,
In general, the general principles are that if it's high grade changes, they're less likely to regress, a little more likely to stick around.
Yeah,
become cancer than those we tend to treat.
God, would I get another LEEP?
We do sometimes do another LEEP procedure. Yep.
Ugh.
And actually some women end up with hysterectomies for that
really?
reason.
So if let's say I hope I don't, but let's say I did go down that track, would I get a full hysterectomy or a partial hysterectomy?
So that's not necessarily a term that we use in the medical world.
Okay.
Because it's kind of confusing, but a lot of patients do kind of talk about it that way. And what I think you're referring to is meaning leaving the ovaries behind.
Yeah.
So in general, we would leave the ovaries behind because they're not bothering anybody.
Yeah.
We just want your cervix out of there.
Yeah.
So we take your cervix and the uterus that's connected to it.
Okay.
And leave the, basically when we're doing a LEEP procedure, we're taking a part of the cervix. And then, if you needed an aggressive LEEP procedure, it's your second or third or whatever, we kind of take more and more of the cervix.
Yeah.
But at some point, we got to take the rest of it too.
Yeah. So I'm sitting here thinking, if this does happen to me, do I have the option just to go hysterectomy, or would you recommend another LEEP?
Usually, it depends on the pathology. It depends on a lot of things, but in general, I would err toward the LEEP first if I thought it was appropriate, just because it's such a. I mean, you saw it
wasn't that bad.
It's an outpatient procedure.
It is,
and the recovery's not that bad. A hysterectomy is a little bigger procedure.
Ooh, is
more
it a lot?
downtime?
It is. Oh, bleeding. Is there bleeding? Like what's?
Well, higher risk of bleeding in the surgery. But
Is there aftermath bleeding with
Not
a
as
hysterectomy?
much.
Okay.
Not as much.
Well, because there's nothing
Yeah.
there, right? Yeah.
Hopefully there's nothing there.
Yeah. Do you feel, let me ask you a question. This sounds crazy. Do you feel some sort of way taking that out of a woman? Like, does that feel weird?
I mean, I've had women feel all different ways about it.
Yeah.
It's just my job. It's like what I
Yeah.
do every day. So it doesn't make me feel any kind of way usually, but.
And then what does the vagina feel like? Like, do you just take the cervix out and you close it? So it's a dead end.
Yep. It's called the vaginal cuff. So it's
okay. Is he going to feel that? Oh,
I don't know. It depends on the woman. Everyone's a little different, but
Mm-hmm.
in general, the way the cervix is, a lot of times you don't necessarily feel the cervix when you have penetration anyway.
Yeah. Okay.
So it's kind of like, I don't know.
Interesting. No one talks about this, and no one talks about it.
Yeah. Yep. But if I were to do an exam, it usually takes a little work to feel the cervix. Although it depends on the woman. Yeah. Everyone's vagina is a little different. Some people have longer vaginas. Some people have shorter vaginas. Some people, it's really hard to find the cervix and feel it. Some women,
really?
Which I imagine a penis would have just as much trouble.
Getting up there and finding it.
Yeah. But then some women, the cervix is right there. So
I feel like my cervix is right there. Men always talk about the strings. Like they can tell. Yeah.
Some guys, yeah. And again, that's all anatomy too. So
wild. Yeah. And it's everybody's different.
Mm-hmm.
Well, hopefully my HPV regresses. I'm doing all the right things. I'm taking the pills. I got the shot. I'm doing all these things. I'm hoping that like I have a normal PAP. That'd be great.
Yeah. And we see that commonly. So I'm optimistic.
Prayers up. And I'm still laughing about the fact that I went into my exam and I was like, can you take a picture? I was like, what does it look like up there? And it was just like a burn victim. Like, oh my God. You're like, this is normal. Everything's healing fine. I'm like, oh my God, this is terrible. But I will say this. I'm glad I did it, right? Like got rid of that prevents me from getting cancer. That's amazing. And that shit, you can die, right? And then also, it really wasn't that bad. It really wasn't. I'm glad to hear that. And no after effects. Like I was so nervous about that. Will it impact my orgasms? Will it impact sex? Will it hurt or whatever? I've had zero. It feels the same, exactly the same. So good to know.
That's great to hear.
Yes. You did an amazing job.
Awesome.
Okay, so let's talk about pap smears really quick. And I'm wondering, because I have a lot of different friends that say different things. Is it 1 year or 3 years? I know for me, it's 1 year because I have HPV. But like, what is the rule now?
Yeah. So the answer is it depends on your history.
Right.
So our current guidelines tell us to start at 21. And then if your PAP is totally normal, and let's say you have a history of all normal PAPs and everything, then typically we do the PAP every 3 years.
Okay.
A lot of people are confused about a PAP, the difference between a PAP smear and a pelvic exam. So every time we use our speculum, that's the tool that we use to look inside the vagina and see the cervix. Every time we use that, we're looking in the vagina, we're looking at the cervix. We're not necessarily doing a pap smear.
Yeah.
So I have a lot of patients that are confused and think that every time we do that, that's a pap. And so they think that's a pap smear. The pap smear is a very specific cervical cancer screening test.
Yeah.
Where we actually take a brush and we brush the cervix and then send those cells off to pathology where they look under the microscope.
Yeah.
So typically our guidelines say we should do that every 3 years, I'm sorry. There are some docs out there that still do it every year.
Should you get a pelvic exam every year?
Anyone reproductive age, I am of the mind that yes, you should. There's plenty to talk about.
Yeah.
And there's plenty to screen for. So yes, every year, as women get older and further past menopause, sometimes we can space that out. And actually that's kind of controversial in the field as well. So, but anyone of reproductive age, anyone having sex, multiple partners, absolutely every year.
And then mammograms is every year as well, right?
Every year.
Your breasts can change. And you do self breast exams. I feel like we kind of a lot of women miss talking about this. You should do self exams. Your doctors, like you said, like that pelvic exam, also a breast exam at that time, right? Like that's important. Because I do feel like a lot of my friends that have had breast cancer, they said to me, Adrienne, I had a normal mammogram. And my self-screening is what found the lump. And that's important.
Many, many women find their own lumps. And that's the whole reason we want you to we're actually calling it self-breast awareness now.
Yeah.
So the whole idea is just be familiar with your breasts. Don't get intimidated by the formal monthly shower circles or whatever that you've been trained to do, so.
Well, I have a question for you
Get
because
to know
I
your
have
breasts.
dense breasts.
Mhm.
And so like, what should I look for? Does any sort of change? Because mine are dense.
Yep.
You know what I mean? Yeah.
Changes, something that's different from one side to the other.
Or any pain. Is pain probably a...
Pain can be a sign there's something that we need to check out, but pain is not always cancer. And actually, usually most breast cancers are not painful.
Good to know. Yeah, I think it's just like looking for anything abnormal and then
Mhm.
bring it up to your doctor.
Mhm.
That's why you should have that excellent communication channel with your doctor for
Mhm.
sure.
Yep. We see a lot of patients who, oh my gosh, I found something yesterday
Let me ask you a
and I'm
question.
freaking out.
Dr. V, when somebody comes in, can you tell or you don't know? Like, you can tell?
Usually if they can feel it, I can feel it.
Mm-hmm.
And then I say, yep, let's check it out.
Yeah. It could be benign, right?
Absolutely.
Yeah.
Many times it is.
My mom had a benign lump removed. Yeah.
Yeah. Many times it is.
Yeah, that's scary for sure.
Is.
But it's important. But you know what? It's better to be proactive than reactive, especially when it comes to breast cancer, So, all right. So we talked about pap smears, annuals, when you should get them all. Let's talk about menopause because I'm nervous about it. And I know a lot of my listeners are going through the change, what changes occur, especially how it affects hormones. And like, where do we go if we're feeling like our hormones are off? The gynecologist, our primary care, what do we do? And is menopause, I know it's this, I don't feel like it's that studied, but I know like people have personal summers and they're like, my libido is gone. And so what do you say about menopause and what do you suggest about it? Like I know it's a wide variety.
Yeah, it's a really broad topic. And actually it's so hard because, we spend a lot of time, teaching our teenagers, like, this is what your period's going to this is what's going to happen. You're going to have period and you're going to have urges and whatever, and here's what
puberty,
you do.
right.
Here's puberty.
Right.
And then nobody tells you about menopause. It's just like, see ya.
Right. It's so true. No one talks about it.
So nobody talks about it. And we wish we could spend, 20 minutes talking about menopause, and that's one reason that you come to your gynecologist every year and you develop a relationship, because those patients who are starting to get their periods a little more irregular in that age group, I do start saying, hey, these are some of the things that might start happening, or some of the problems some women have, So.
What is the first sign of menopause? Missed periods?
And it's different for everybody.
Yeah.
So what happens is as we get older, as our ovaries start not ovulating as regularly, our estrogen levels start declining, our ovarian reserve starts dropping off, because unfortunately we're born with all the eggs we're ever gonna have.
I know, isn't that crazy?
Which is crummy if you're somebody who wants to have babies later anyway. Our estrogen levels start going down, and so then our periods might start spacing out. They might start getting lighter. Some women start having hot flashes and night sweats, and that can come along with irritability and trouble sleeping. And
I've heard the trouble sleeping is a real thing, by the way.
Yep. And some women do have libido changes and mood changes, and a lot of it goes together.
So talk to our gyno though. Like, you don't go to your primary care doctor?
I would say it probably depends. Some primary care docs are probably more comfortable talking about that stuff than your gynecologist, but even a general gynecologist should have a really good base.
And then what do you do, Dr. V? Do you put me on a pill? Like, what do we do to fix this? If I'm having personal summers, if my sex drive goes away, my God, I can't even imagine that. But like, if it did, what do we do? Do we get on meds?
So, there are some, first of all, there's a really wonderful resource out there called the North American Menopause Society. They have a wonderful website for patients. They have a whole section on sexual health. Highly recommend it, because there's lots of rabbit holes you can go down on the internet. There's lots of people out there who are very happy to take your cash, check your hormone levels, sell you all kinds of things. But there's not great evidence for that. The best evidence that we have, and again, this is coming from somebody who is trained as an allopathic traditional, medical doctor. So not saying it's the end all be all, but, in general, our philosophy is using medications as needed. So we used to think, let's put everyone on estrogen replacement because that's what you need after menopause, because your estrogen levels go down. You feel better, you stop having the hot flashes, that kind of stuff. But then we found out actually it's not good for you. So we found out that women were having a lot of issues, strokes, heart attacks, that kind of stuff. So then we stopped using them for a while, and then we said, well, wait a second. actually, it really depends. So we learned it really is very subtle differences, when you start the hormones compared to when you went through menopause, how long you were on them, what's your history, what's your dose, what type. So it's incredibly complicated and subtle. So that's why I would definitely start with your gynecologist.
Okay.
If you're having struggles with those kind of symptoms, start with your gynecologist. And they can best go through your history and talk to you about the risks and benefits and what you might qualify for.
Yeah.
But in general, it's kind of a temporary thing. Most of my patients who are kind of further past menopause, a lot of them actually love the stability. So when you're in your reproductive age,
Right, you're going through that cycle.
Yes, especially when you're getting, going through the change. So the worst of it tends to be while you're transitioning from having periods to not having periods. So that can last a few years. And that tends to be the worst of it. After that, things kind of stabilize, and a lot of women are very happy with that freedom. A lot of women, by the way,
you're not going through that mood swing. You're not,
Yeah. And I should add that actually most women probably don't have as many issues with menopause as people would lead you to believe. I'd say most of my patients around that age group, they're like, I'm fine.
Okay.
Have the occasional hot flash, no issue.
That's good to know. Yeah.
But then some women really suffer. So it can really depend on the person. And there's a lot of strategies that you can talk about with your gynecologist before you go on hormones. There's a lot of other things to try too. So
someone asked a very specific question. They said, is there a difference between synthetic or bioidentical hormones? I don't even know what bioidentical means.
Yeah, exactly. And that's kind of the point. So bioidentical hormones, I think it's mostly kind of a marketing thing. Like, it sounds nice, but really what it's trying to do is mimic the hormones that we have naturally.
Okay.
So, it all depends on what your definition is. But in general, we think, so the short answer is no, there's not really, from what we can tell, there's not really a difference.
Okay. That's good to know.
I find in reality, it ends up being insurance coverage that dictates what we use. Yeah. Insurance coverage and convenience. So, there's all kinds of preparations out there, just like there's all kinds of birth controls. There's all kinds of preparations. And so it tends to be, what's the patient's preference for method and what will insurance cover? Yeah. Because unfortunately, that's a major issue for a lot of women.
Oh, it definitely is. Yeah. What's funny is I was telling Katina, I feel like medical bills and all that stuff is changing. And my LEAP procedure cost me like $3,000. And I have excellent coverage, right? And I'm like, that's changing. Something's changing. Like, that should not have cost me that much money for that. But yeah, it's...
Yep.
Like, I got a bill the other day. It was like $982. I'm like, God damn. It was like $83, $63, $26. And it's like, it's all out of pocket.
Yeah. Healthcare is definitely something I could have a lot of things to say
about, I'm
so.
sure. Okay, Dr. V, I have some rapid fire questions for you. Are you ready?
Yes.
Okay. So I want to talk about this, and this is like my personal question. Can we please talk about keeping it balanced down there? I know UTIs, I feel like were a thing in my 20s. I haven't had, knock on wood, one of those in a long time. Yeast infections, the same, like every now and again, but it's rare. But BV, let's talk about it. I feel I've never experienced BV like I have since I've been in the lifestyle. And I know it's because of multiple partners. What do I do? Like, do you believe in those, what are they? The, boric acid suppositories? Do you believe in those? Do those work? Do those just fuck shit up more? Like, do I come to you and get antibiotics? Because when I did have BV after my surgery, you knew before I did. You were like, hey, you have BV. What do I do? Help me. Because like, I'm so tired of dealing with it.
BV is very frustrating, for sure. And I've had lots of patients that some people get it once in a while. Some people get it commonly.
I hear like once you get it, I feel like it never goes away. Is it going to go away?
Yeah.
I want it to go away.
It's probably more about the fact that you got it and so something caused it, and now, unless you fix that thing, maybe it's going to come back. And the truth is we don't know exactly.
Yeah.
So BV is not completely understood. So there's a lot we do know. There's a lot we don't. So like I was saying before, there's natural healthy bacteria in the vagina. So that's called lactobacillus, and it produces lactic acid, which is acid. So the vagina is naturally an acidic place. So that's why things like boric acid, it sounds scary, but actually restoring the acidity is not a bad thing. So that acidity that your natural lactobacillus creates, that keeps away a lot of the bad bacteria.
Okay.
And
So it's not bad that I use a boric acid suppository every now and again.
No.
Okay.
And actually there's some good evidence for vaginal boric acid for women who have recurrent BV.
Because I've used it and I feel like, am I just going to keep getting BV because I use this? I don't know.
So anytime that you throw off the normal balance of bacteria, that's when you're kind of setting the stage for potentially getting BV. And so it's probably a complicated balance of the fact that you're getting, the natural pH, the natural lactobacillus, that's getting disrupted, plus the fact that maybe you're getting some strain of, bad bacteria that then takes over and causes the BV. So it's probably a complex kind of play of both of those things. We know that women who have multiple partners, we know that they have more rates of recurrent BV. We know that
the dreaded BV.
Yeah.
I've gotten it. I've had it like 3 times in the last year.
We know, and actually there are things that naturally throw off the pH. Your period, that is blood, and blood is naturally higher pH than your vagina. And so every time you have your period, you're going to throw off the pH. And so it's not necessarily abnormal to have an abnormal pH. That's normal. That's every month. But then, if you have a normal, healthy bacterial flora, as we call it, that should then self-correct. When you have sex and there's semen, semen naturally is basic to neutralize the acid. That's how the sperm gets in there. It basically has to have a special coating on it to help it penetrate the acidity and survive the acidity of the vagina. So that's normal. So anytime you have sex and have semen in your vagina, that's going to throw off your pH. So anytime you take antibiotics, now you've wiped out your good bacteria, and now you've set the stage again for...
Oh, great. Because I just got off clindamycin because I had tonsil problems again.
Yeah.
And so, okay, so my pH is probably off right now.
Potentially.
Great.
Now BV is tends to not be dangerous. We know
it's
that...
It's just the smell. Like you can smell
it's
it.
Irritating. It's annoying. It's in some situations it can cause issues. But in general, and actually BV we know can put you at higher risk of getting other STIs. So hopefully you're already preventing those, but still, you would prefer not to have it. So,
well, you're making me feel better about using the boric acid suppositories because I'm like, am I overusing these? If I take 2 a week, is that a lot? Like, I don't know.
A lot of times for women who have like a bout of recurrent BV, one of the things in addition to maybe trying the antibiotics to get rid of it, every night for 30 days.
Every night?
Just boric acid in the vagina, get rid of, and then see what happens, see if that kind of helps reset things. Now you can't have sex while you're doing that because you don't want to expose somebody to that. The other thing, or maybe you just need it every time, right after your period, maybe you use one to kind of reset things quicker if your body's not resetting.
Yeah. Or after sex, use one.
Absolutely. Okay. Yep. Condoms, we know condoms help reduce the risk. Again, you're protecting yourself from that semen and, whatever bacteria is on his skin. So that's the other thing is, what's he using on his skin? If he's using some kind of fancy smelly, soap that guys like to use.
That. Yeah.
And then they put it in your vagina. And now your vagina is irritated and angry. And
yes.
So there's some women are more sensitive than others again. And of course, condoms help protect you from that.
In my next life, I want a penis, a big one. I just really do. Like, I just want to know what it's like.
But then you just want to play with it all the time, wouldn't you? But I guess they do.
I totally would. I would just jerk off all day long, and then I would just dip my dick in places, and I would just keep going about my business. That's all you have to do. And you can pee anywhere, and you can do whatever you want. And you know what? Like, let's just not even... I tell people all the time, like, next life, I want a huge cock. Like, that's what I want. And medium-sized balls. Like, I don't have to have big balls. I just want medium, That'd be nice. If I'm always so lucky. Oh my God. It is true though. I would just play with it all day long. Like,
yeah.
Oh my God. Okay. So I get a lot of women asking, is there something you could do to increase your sex drive?
That is a complicated answer. So, women's sex drive and men's sex drive are incredibly different.
Yeah.
So, and women's sex drive is so complicated. And I actually get that question from a lot of patients as well. It has everything to do with, how we're feeling physically, our mood, our self-esteem. Are we stressed? Are we busy? our relationship.
Yeah.
You know, how close do we feel to this person? It is incredibly complicated. And guys are not like that. You know, just physiologically, they're different. So the short answer is there's not a simple answer. There is something that's called hypoactive sexual desire disorder. But that requires that you rule out everything else. The other thing is a lot of medications can have side effects that cause decreased libido,
right,
or decreased enjoyment of sex.
You know, antidepressants are a huge thing.
Absolutely.
Yeah.
And who's not on that?
Right. I mean,
for anxiety, depression. So that's a huge factor too.
When I was going through my divorce, I got, for the first time ever, I experienced depression. I was one of those people that was very ignorant and said, just get over it, you know, moving. I never experienced true depression until that happened. And my doctor was like, hey, let's put you on some meds. I think I was on, I can't remember, Lexapro. I can't remember. And I couldn't orgasm. It terrified the shit out of me. I was like, no way. I can't ever take this again.
Yep. And then pain plays a lot in that too. So if people start having issues with sexual pain, you know, now you're not wanting to do it, and that it's like a cycle. It's a vicious cycle. So
talk to your doctor. Figure it out. Yeah.
There are 2 FDA approved medications that just came out in the last several years for women with hypoactive sexual desire disorder. Neither are perfect. And actually, I would also argue, you know, who developed these drugs and what are they treating? And because in general, if you're not feeling like having sex, you know, and that's not bothering you, like whose problem is that?
Yeah.
Is that your problem and you're not happy with that? Or is that your man's problem or your woman's problem or, you know, your partner's problem, I should say.
Right.
You know, whose problem is that? Because a lot of women,
I actually do get a lot of women that come to me and they say, Adrienne, I wish I had your sex drive. I wish I was more like that. I wish I thought about sex more. So I think people do care. And also it creates that, it's the connection between you and your partner. It just is, you know. And
there's a lot of reasons that people might want to continue. So it's complicated is the short answer. But there are some things to try. But look at your medications. There's great evidence for spending time together and connecting. Yeah. So date nights and things like that. Yeah. There's great evidence for physical exercise together. So, you know, get those endorphins going. There's a lot of good evidence for trying something new together, especially sexually. So go to the sex shop together, pick out some toys.
Ask me for recommendations. Get the sex swing.
Listen to Adrienne's podcast. Yeah. Watch porn together.
Yeah.
Go to the hotel together.
By the way, one of my favorite things ever to do with a partner is to watch porn and then reenact it. Hotter than you could ever imagine.
And actually people study these things and there's good evidence for all of this. Yeah. There's also, there is such a thing as sex therapy and you can find a licensed sex therapist online. Yeah. To find. That's a good tip. To go look for one and it's normal.
Yeah. So we talked about annual appointments and if you care if people are waxed or shit, you can care less. I know that. Okay. But I have a question. And have you ever found a condom during an exam?
So I have found the occasional retained tampon, you know, that people forget they put in, you know, last week or whatever.
Oh my God.
And I did find a condom once, but but she had come in saying, you know, she showed up at the office freaking out because she couldn't find the condom. Oh. It's like, we just had sex and I can't find the condom and I can't get it out. And I don't understand that. Come in and I will help you.
Oh my God. I don't understand that because it's like, you got all this like, I mean, you said every vagina is different. So it's like deeper. So it's like stuck in there. It gets behind the cervix. I'm confused. How do you, because it's only so deep.
It's a blind ending. You're right. But everyone's anatomy is a little different. And, you know.
Oh my God. Yeah. I did have a micro penis before and the condom slipped off and I was like, it's in me. And I had to take a Plan B pill. This is in college. Yeah. So like, I was like, oh shit. Ugh. Okay. So something else that I wanted to ask you, if you notice when people have appointments with you, and I think we all do it. I don't do it because I don't wear underwear, but it's a big thing. Like women and a bunch of people ask me, they're like, do doctors notice how we stack our clothing? Like, how we hide our bra and underwear. And for me, I just like lay my shit on. I just don't even think about that. But do you notice that? Or you don't even look
You
to
know,
see?
I didn't even know that was a thing until my sister sent me like a video or something on Instagram.
Yeah.
I was like, haha, isn't this funny? And I was like, what is this?
Like women are stashing their underwears or hiding their bras.
Yeah, no, I don't notice. The only time I notice is when I have to move your clothes because they're sitting on my chair.
Oh,
so
I will tell you one thing that I do get stressed out about is that I'm waiting in the room and like, as they say, get dressed, get changed. And I'm like waiting and then I'm sweating and I'm like, oh my God, my butt's sweating. And then my boobs are sweating. And I'm like, oh my God, I just hurry up, come in here before I start getting sweaty. Cause I'm like,
I'd say a lot of women worry about that. And I'd actually rather you be sweaty than cold and sitting in there cold and naked. And
I know, but I'm just like, oh my God, please hurry. Cause I'm like starting to stick to the fucking paper and it's in my ass crack. And then I'm like, oh my God, when you come in, I'm like, I'm very verklempt right now. I'm hot, I'm sweating. And now I got to spread my legs. Like it's a thing, but you don't ever care about that. Doctors just do not care.
No,
okay.
No, I don't think I notice.
You're like, let me get in there and let me get out.
Yeah. It's kind of the great equalizer. You know, I get in there and you're wearing the same, pink gown and white sheet that everybody else is. And,
yeah.
I notice people's socks. That's about all I see. Either their pedicure or their socks.
Yeah.
Sometimes I'll be like,
see, I'm self-conscious about that too. Like, I'm like, oh my God, I haven't got a pedicure. Oh my God, I just got my pedicure. I look good. I'm good. I think about that. That's funny.
I never notice when it's not there. It's more just like, oh, those are cool socks. Or whatever.
Oh, it's funny. Okay. Next question. How vital is it to pee after sex? It's for real, right?
It's a good idea. Yes.
Okay.
So, the women's urethra is much smaller than a man's, which is much shorter, I should say. Mm-hmm. So it's like a direct conduit to the bladder, which, like I said, should be a sterile area, no bacteria allowed. So when you're having sex and the urethra is getting, friction and stuff all up in there, there's usually a little bit of bacteria that can creep in. And so when you pee after sex, you're flushing all that bacteria right at the entrance. You're flushing it out.
Okay.
So that it can't climb up and infect the bladder. So we do see women that have more frequent UTIs if you don't pee after sex.
I feel really stupid right now. I feel like incredibly stupid, but I'm sure someone else is going to relate to this. I thought you peed after sex to avoid yeast infections and BV. I forgot about the UTIs.
It's all
so
about
that's
UTIs.
The reason. Okay. I don't know why I didn't even think about that. Like that's what it's about.
I guess it makes sense if you're also kind of trying to
just getting everything out.
The semen kind of drip out.
Yeah, like
there.
everything get out. Yeah.
I think that makes sense too. I mean, the more that's in there, maybe the longer it hangs around. But I don't know. It's more about the UTIs.
Okay. All right. And then we've talked about IUDs. We've talked about that. I'm going to skip past that. Okay. What is your preferred method of birth control? I'm sure you're going to say it's case by case, person by person, but like, What do you think works the best? What do you think is least impact on your hormone? Like, what do you think is?
I can tell you, I loved my Mirena. I had 2 of them. Loved them. In general, OBGYNs, we love the Mirena.
Okay.
For so many reasons.
The IUD.
That's the Mirena IUD. Yep. And actually, there's another brand, Liletta. There's different brands, but basically the hormonal IUD, it makes your periods lighter.
Yes.
So, you got problems with your periods. Here's a hormonal IUD.
Yeah.
Avoid surgery. It's awesome.
It's the reason why I got an IUD is because after I had my daughter, I had periods for 2 weeks.
Yeah.
It was unbelievable. Yeah. And the IUD, and now, like I said, you placed a new one during my surgery, and I have been like, oh my God, like I just want to like praise the Lord because it's been so, I've had nothing. Yeah. I used to use the menstrual cups, which I really love. And I haven't had to use a thing. So,
yeah, we love as a field, we love the IUDs. But actually I do kind of love the good old fashioned birth control pills too, just because they give you the most predictable periods. They really regulate your cycles. And some women really like that, know, because the hormonal IUDs don't give you as much cycle regulation. They're pretty local in your uterus. And so they really control the bleeding, but they don't necessarily regulate all that beautiful symphony of hormones that I was talking about, which some women prefer that. And some women need that regulated, so it just depends on the person. But it's hard to beat.
What about the thing in the arm? What is that?
The Nexplanon.
Yeah. Don't you gain a lot of weight with that? Like, I think Dr. Repka told me, he was like, you don't want that.
Yeah, I actually, some of our docs do have the Nexplanon and love it. That one is more person dependent. So about a third of women, I'd say, have no period and it's great. You put it in and you got great birth control for 3 years and then you change it out and you don't
Well,
have
the IUD is even better because it's 8 years now, right?
Yep. They just extended it to 8. So,
yes. God, I'll be hopefully like for me, I got it done. I'm 41. Shit, in 8 years, 50.
So maybe we'll do one more for you and then
one more. Oh,
and then you'll be done.
Okay.
just to be safe.
Wow. So yeah. So I mean, I guess that's true. Like, how do you know if you're going through menopause and you're skipping a few periods, but if you have an IUD, you don't know. Right. So yeah,
you might not know, and that's kind of nice.
Right.
So then maybe we make a plan. Maybe when it expires at age
49.
It would be for me. Then it would be So then we would decide: do we take it out or do we put a new one in and then get you to 50 something and then take it out, and then by then you should be long over menopause.
There's so many different things that can happen. There's just so many. And then I could have, God forbid, I might have a hysterectomy and then boom, I don't got to worry about nothing ever like that again.
Then you would not need birth control.
Yeah. Yes. It's funny. You spend your whole life preventing pregnancy and then you want to get pregnant and it's like, oh my God. And I was very fortunate. I got pregnant on the first try. I told you I charted, got pregnant first try. And then you prevent it again. Like, I mean, I'm like, oh, hell no, but it's funny what we go through and the different evolutions of the stages. And I will tell you, it's very scary I feel like it's scarier to want to get pregnant than to prevent it. Cause like you want it so bad. It's a lot. So here's the next question. How old is too old to have babies?
That is a great question. Depends on your health, but in general, we consider, over 35 advanced maternal age. Now that's all just for historic reasons. And
that just means what? More testing?
Your insurance may cover additional chromosome screening is basically what it is. So and we use that number for historic reasons, not for any real reason. So in general, as we get older, the risk of chromosome issues goes up, meaning the risk of Down syndrome and stuff like that. But then the other part of that would be potentially miscarriage as well, just because our DNA gets damaged as we get older and the eggs have been there longer. But then also people get more health issues, so as we get older, same reasons that we get more high blood pressure, we get more cardiovascular disease, same reasons. Yeah. Pregnancy is a big stress on your body. And so if we start to see that creep in, so a little bit higher rates.
Diabetes, gestational diabetes, that's huge probably.
Yeah. Diabetes, high blood pressure, preeclampsia. Now, all of those things we can manage. Yeah. So, we offer these days, we offer genetic screening to everybody, regardless of your age, and we've got great non-invasive testing techniques. After 40, so our fertility peaks really in our 20s and 30s. It starts to decline, a little faster after 35 and very rapidly after 40. So we still have lots of patients in their early to mid 40s, I would say. Maybe not a lot by the time you get to your mid 40s. We don't start changing our management in terms of how we, manage pregnant patients with the extra testing at the end of pregnancy and early delivery and stuff like that. We don't tend to get to that until you get after 40. And we've had I'd say it gets harder to get pregnant. And we've had most of our patients kind of in their late 40s tend to be more IVF patients. But yeah, so that's a good question. But a lot of women are afraid to have babies in their 30s, and I would say don't be. So more women nationwide now are having babies in their 30s than in their 20s, and that's a shift from historic norms. Well,
because I think we're spending time getting our education, building our career. You know what I mean?
All good things.
Yeah.
So there's always
I don't
pros
feel
and
like
cons.
God. I can't. With having my daughter, I would absolutely tell her, don't even think about getting serious in a relationship until after 25. And then you have like this 5 to 7 year window. Boom, you gotta, get married, have babies, do all the things. And I'm not a believer that you have to get married to do something, but having a baby is a lifelong commitment. And I feel like something you should make as you're older, more mature, what you want, your direction in life. It's tough. It is.
Pros and cons.
And I will tell you something else too. There is never fucking ever a good time to have a baby. Okay. There's never a good time.
That is
ever.
probably true.
If some people will say, oh, I'm going to wait till next year when I think, no, it's never going to be a good time. I was 31, which I felt like it's a great age, but also sometimes I wish I had an older child. Like a lot of my friends in my 40s, their kids are in high school, you know, and my daughter's only 10. And then I have friends that had kids at 16. Their kids are off in college. Like, you know what I mean? It's just there's just never a good time.
No. Plus there's something to be said for all the energy you have when you're young too.
Oh yeah.
To stay up all night with those kids.
Well, here's the curse of that though. So you have the energy and you have, you know, your youth, but you don't have the foundation, the stability and the finances and all that stuff when you're older. So
it's always a pros and cons.
There's just never.
I will say on that note, if you are thinking about delaying childbearing, there is such a thing as egg freezing. And it's becoming more and more reliable. It's never a guarantee. And so, you know, people who are familiar with IVF and frozen embryos, that technology has been very good for a long time. But egg freezing is a newer thing. So that's something that you would do, you know, as a young woman who isn't ready for babies yet. Maybe you don't have the right relationship or whatever. But
it keeps the health of those eggs.
Basically, the idea is you'd go see a fertility specialist, and you'd have no partner or whatever. So you would just go through stimulation and collect a certain number of eggs, and you would freeze those. And that way, someday, you know, later on,
those healthy eggs are ready.
Maybe you do find the right guy. Maybe you do decide to try to get pregnant. Now you can't. Now you need IVF. And now, good thing. You know, they would first probably try, you know, as you are, but, I'd let them talk about that. But now you have your eggs that are yours.
Yeah, but when you say, I mean, are eggs the important part or is it the viability of holding the child? Like what's more difficult?
Both.
Oh, God.
So, but a lot, and it depends because everyone's fertility declines at different rates. And so I've had patients in their late 30s who need to use a donor egg because their eggs are not working anymore.
Wow.
But they're certainly healthy enough to carry a baby. So, but now that's not your genetic child. Now, now it's still your child. And obviously there's, you know, a lot of wonderful things about that, but it's just different.
Yeah.
So, I've had a lot of patients come to me at 40 and they say, do I need to freeze my eggs?
Do you deal with surrogates? Do you see a lot of surrogates?
We do have some surrogates. Yeah. And that's awesome.
Yeah.
And, but I wish people had talked to you know, my patients about freezing their eggs 10 years ago. You know, yes, now you're 40. You know, we wish we had frozen your eggs, you know, in your early 30s.
Yeah.
So early 30s, mid 30s, that's the ideal time to freeze eggs. You know, you probably wouldn't want to do it in your 20s because you've still got plenty of time.
Yeah.
To hopefully find the right person and do things the old fashioned way.
Right.
That's much cheaper, by the way.
Oh, yeah.
And more reliable. So, you know, egg freezing is not perfect. It's got a long way to go still, but anyway, it's something that I wish people knew about earlier.
Good to know. Okay, let me ask you a question. What do you think about lubes, lotions, and all the potions you can use down there? What would you suggest never using? I'm thinking lotion. Like you should never use lotion down there.
Yeah. So in general, you want to stay away from the oil-based stuff if you're using condoms.
Okay.
Any kind of oil-based lube or natural oil or that kind of stuff is going to weaken condoms. So
good to know.
You'd want to use water-based, silicone-based.
Okay.
Lube is awesome. You know, we highly recommend it, especially as we get past menopause.
I love lube, by the way.
Menopause.
Big fan of lube. Yeah. I even use lube with toy play.
Yeah.
There's no reason, right?
That area doesn't like friction. So lube is good. But yeah, water-based, silicone-based. I generally say to avoid stuff with fragrances or anything that says tingling or warming. That just sounds to me like irritating. You know, like let me make things.
Ew, they do have like that KY hot.
Yeah,
Ew, no. I don't like KY, by the way. It's the worst. It's sticky. It's gross.
Yeah.
Not a fan.
And then, you know, you just kind of have to experiment a little bit. I've had patients tell me different lubes work for them. So,
oh, girl, I know about some lube.
Yeah. So ask Adrian about that one.
I will tell you, if your patients ever ask, a very generic, easy, can be bought at, you know, Target, Walmart, whatever, Astroglide.
Yes.
Amazon. I really love Astroglide. It's my old faithful.
And that I believe is a silicone-based one. So a little bit more durable and
I love it. And it's not sticky. It doesn't smell like I'm a big smell person. And I have this other lube. It's called Turn On. It's a very, it's not water-based though. So it's silicone-based and that's more for like, with your partner. I don't use it on my toys, but, I love it. It's so silky and so smooth. I love it.
That's awesome.
So It definitely takes some getting. You got to play things. But Astroglide is such a great lube. It really is.
And then there is such a thing as vaginal moisturizers that are different from lube.
Yeah, let's talk about that because I have a lot of people that ask me, how do you suggest getting wetter better? So what is that? I've never used that before.
Usually I think about it for women who are approaching menopause or postmenopausal. As your estrogen levels decline, the vaginal tissues are actually very responsive to estrogen. So as your estrogen levels decline, the tissues change. So the vaginal tissues get thinner, more fragile. They don't stretch as well. So they're not as moist. And actually you lose some of that natural healthy lactobacillus as well. So we already talked about that, but vaginal moisturizers, you can use at any age. So you would use them like 2 or 3 times a week. And it's the same way you'd moisturize
vaginal
your skin.
moisturizer. So it's like an out, like, okay.
So you would use, your hyaluronic acid, facial moisturizer. Like if you go to get a facial and they put that fancy stuff on there, it's the same kind of thing. So it's a heavy duty moisturizer that some of them are gels. Some of them are little suppositories.
Is it called Refresh? I've heard about this. There's a brand called Refresh.
There is a brand called Refresh. I think that's a little bit different. And actually it's confusing because I've had patients bring me these things because there's a brand and then there's different products from the brand. And so I'm like, well, Refresh what,
Right.
And just bring it to me and show me. And I don't know what it is. Or sometimes I'm looking it up online, like which one is this? So
I feel like I need to try that. The re-wetting thing. I feel like I need to try it.
So Replens is one brand that I'm familiar with. That's a gel. There's one called Luvina. There's one called,
and this
Reverie.
Is something that you do like throughout for a duration and then it just helps you, or do you do it right before?
Nope, it's just a moisturizer. So you just use it regularly.
I do have a pro tip, by the way, and I'm a big fan about this because sometimes, and I luckily have not had any issues with getting wet because foreplay is key. Your partner should be,
absolutely.
come on, you got to
100%.
warm that engine up. Ugh. Okay.
And it's not just lubrication.
Yes.
It's blood flow.
Everything. Yeah.
So you can't just throw some lube on there and call it foreplay. You gotta warm up. You gotta really,
so true.
Bring the blood flow to the tissues.
Yes.
They're more elastic. They're more forgiving. There's, all kinds of wonderful things that happen.
I love the science behind that. Absolutely. But what I want to say as a pro tip that I have is sometimes I will take a little bit of lube, like especially at the end of your period, I'll take a little lube and stick it up there if I know I'm going to be getting it on. They don't know. No. And it's just a little bit of lube. And it's just, and especially around the outside, that helps with the friction going, you know what I mean? So
and you'll notice
big fan of that.
as your different times in your cycle, your vagina is going to feel different. That's all hormones.
Yes.
And same with different birth controls, systemic birth controls, hormone, IUDs, it's all going to affect everyone a little bit different. Some people feel that the NuvaRing, which is a combined hormonal birth control that you put in the vagina. Yeah. Some people find that they have more vaginal discharge with that. So some people actually like the extra moisture down there. So that would be one thing to consider if they're having trouble with that.
Now, see, I wouldn't be a fan of that.
Not everyone likes
all
having
the time,
that in
right?
there.
Well, also I don't wear underwear, so like that would be a problem for me,
right?
Because
And then some people complain about the vaginal discharge. So
no,
depends
not a
on the
fan of
person.
that. Yeah. Okay, so here's a huge question, and by the way, I put on my Instagram, I was like, okay, my OBGYN is coming on. I'm so excited to have her. Give me your questions. I swear to God, probably 50 people asked this. Okay, is squirt pee? Is it pee, Dr. V? I don't know. Is it? So I'm a squirter, actually. So
this is one they don't teach us in medical school or residency.
Okay.
So I had to look into this one a little bit more. But in general, you do have some glands around the vaginal opening that do help create lubrication. And there is such a thing as female ejaculation and squirting and all of this. And there actually are studies on all of this. So I was looking into some of those. The glands don't hold a lot of fluid. And so, when you talk about squirting, it's usually a lot like a decent volume, it's not just a couple of cc's. Right. And so anything more than just a little bit, a few milliliters is probably coming from the bladder. Oh, yeah. So, and actually the stuff I was reading was talking about the difference between female ejaculation and squirting. Yeah. So there's actually a difference. And so, the discharge that comes out of the Skene's gland, which is, one of the glands that lubricates the vagina, it's kind of equivalent to the male prostate. That's a few milliliters, and that's, they consider that female ejaculation. Whereas squirting, which is a, more like an ejection of a little of basically out of the urethra.
Yeah. Okay. But can I just tell you, it doesn't smell like pee.
Right. And so actually the stuff I was reading,
it's like a little mix.
Okay. It was like dilute urine.
Okay. All right. Well, I'm thinking to myself.
So there are studies about this, and then there were a lot of different papers, and they were like measuring, the substances in there. It was interesting. Okay. But it comes out of the urethra, and a lot of it's from the bladder. So there might be some other stuff mixed in there, but yes. Okay. So I don't know how to answer your question. I guess yes and no.
I'll take it. I think the men out there are like, that's fine to say it's,
Yep. That's the best answer I could find for you.
I've always been a squirter. Well, ever since I had an incredible fuck buddy. I mentioned him earlier, Pawn Star. He was 10 years older than me, and he taught me what good sex was. He taught me how to suck dick. He was literally like a fucking teacher. He would be like, Adrian, but it allowed me, because I was like, no man's ever given me an orgasm before. And he's like, you need to let yourself go, and I'm going to put in the time, and I'm going to see what you like. And like, he schooled the shit out of me, and I became a squirter with him. Like, cause I just like let myself go, and it doesn't happen every time, but okay, well, there we have it.
And everyone needs a teacher like that, by the way.
I know.
I get a lot of women that come to me and they say, I don't think I've ever had an orgasm, and you're not weird. That's normal. Wow. That's common. It's, and exactly what you're talking about. You got to experiment.
Yeah.
No one else is going to know what you like until you figure out what you like.
I used to joke around, well, now in my life, the people I surround myself with, no one is denying it. But I remember being in high school and stuff, and I would be like, girls would be like, I don't do that. And I'd be like, come on, like, let's just be real. Like, we're all doing that. And they would deny. And I'm like, there's nothing to be ashamed about. Like, I don't know.
That's the difference between a teenager and a grown-up.
Yes, but even in college, I remember people being like, I don't do that. And I don't, and I even have people now that, they'll bulk at toys or be like, I don't use toys and I don't do, and I'm like, well, you're missing out because,
I would agree as a professional.
Yeah. Like, you should know your body best. And I think masturbation is extremely healthy.
Yep.
Number one, it allows you to relieve that stress and all of the above, but also get to know your body and what you will like with your partners. So.
And the more you think about sex, the more you have sex.
It's so true.
The more you're going to want it. And that goes back to what you were saying earlier about the decreased, sexual desire. That's 100. There's good evidence behind that too.
Yeah. You remember when that book 50 Shades of Grey came out and how all the husbands were like, oh my God, it's because they're reading about it. They're thinking about it, and then they're doing it. It's so true. Very true.
Good evidence for that too.
Yes. Okay. So someone asked, this is a very specific question, with posterior vaginal prolapse, is sex harmful? I don't even know what that means, but.
So that kind of goes back to that pelvic floor stuff we were talking about. So some women have more descent of certain parts of the vagina and the vaginal tissues, and a lot of that's genetic, unfortunately. But in general, sex should not be dangerous with prolapse.
Okay.
Sometimes it can be uncomfortable, weird, whatever, make people feel all kinds of different ways, but it shouldn't be harmful.
One of the things I remember you said to me when I was terrified and in your office, and we had like the pre-op before my LEAP procedures, I was like, am I going to be able to have an orgasm? Am I going to, is sex going to feel normal? And you said to me, you were like, Adrian, you might have a moment of where mentally you're not there, but physically you are, or physically you are and mentally you're not. And I appreciate you bringing recognition to that, because it's very true.
It is.
Both have to be in sync for that to happen. And
I would just say, also ask your doctor, just say, hey, is it okay for me to have sex with this, whatever I have going on personally? And hopefully they'll be like, oh yeah, no problem.
Right. Like how I was asking you, I think I saw you 2 weeks after my LEAP procedure and you said 2 more weeks. I ended up waiting 5. I felt like 5 weeks where I was super comfortable mentally and physically ready. So if anybody's getting a LEAP procedure, I feel like 5 weeks is pretty good. And the time did fly by, even for a nympho psychopath like me. Like, I was still using my toys, clit toys, but nothing inside. And I feel like 5 weeks was the perfect sweet spot. And I was good, girl. I was good to go after that. But all right, I think you've answered all my questions. Awesome. That was a lot. Awesome. So I just want to thank you so much for being here. It means so much to me, and I have a little surprise for you.
Oh dear.
Okay. I'm pulling up a bag.
Oh my goodness.
I got you a little gift.
Aw.
So I'll let you open that up. Something about me that I started, and it was with my primary care doctor. He was like, Adrienne, you've got to start reducing stress. And so I picked up a paintbrush and I started painting.
Nice.
So I painted you a little something.
Aw, I would love that. I hope it's...
Wait till you see.
Oh, I love it.
So it's an
Did you
oyster.
paint those ones in there?
I did.
Oh,
Yep.
nice.
Yep. So I started painting, and it's very Georgia O'Keeffe.
Yes.
Yeah. So it's an oyster. It is. It
I
has
love
like the
it.
gold, pearl, but it kind of looks like a vagina.
It
right?
sure
Like,
does.
flip it the other way. It goes. Yeah. There you go.
Okay. Oh, yes.
Yeah. See the vagina.
I thought this was the clitoris here.
No. So flip it over, and then yes.
Beautiful.
So you can put it in your
You can do it either
office.
I will do that.
I was like, it'll look good in there.
Yeah,
But I
thank you so
can't thank you
much.
enough for being here. It means so much. And if there's one thing that I feel like people can learn, it's just to talk to your doctor.
Yes,
and
we're
talk
people.
about things. Yeah.
And we wouldn't work as hard as we did if we didn't care.
Yes. So, well, this was super fun. And I just cannot thank you again. So thank you for being here.
Oh, you're so welcome.
It means so much. And I hope you like my vagina hanging in your...
I will always remember that this is your vagina. I will not tell anyone else so that they don't won't know my secret.
You know what? Someone's going to look at it and they're going to be like, is that a vagina? But I
hope they
kind of
do.
like that. When you saw my pictures hanging in the basement here, were you like, what are those?
No.
Or do
I
you
was
think
like,
oyster?
I thought they were oysters.
Yes.
I was like, oh, like
Okay,
little,
perfect.
little ocean theme. I like it.
Yes.
Yeah.
Yep. So funny. Cravers. Coming up, I have so many hot experiences to share, including an insane FMF that I just had last night. And I gotta tell you something. I'm fucking dead tired. Like, I'm so tired. When you use your body as an amusement park, it drains you. I don't think people talk about that in the lifestyle. When you have these incredible marathon sex sessions, like, I'm fucking tired. Okay. But it was so hot. And I had my first strap-on experience and DVP, that's double vaginal penetration, for the first time. And let me just tell you, that was intense and I fucking loved it. And now I'm going to be addicted to that. So the bar is raised higher yet again. This weekend is the hotel takeover and I have another play date scheduled with my dom. I tell ya, I am living the fucking life out here, both naughty and nice. 'Tis the fucking season, baby.